It's a common condition where someone does not get enough oxygen while sleeping, but the growth of sleep apnea continues to rise with more and more Americans turning to machines such as this one each night just to get that good rest. Brooke is sitting down asking questions on the risks faced by sleep apnea.
Well, joining me now is Premier Health Advanced Practical Register Nurse Katie Kirk. Thank you so much for being with us tonight.
Absolutely, thank you.
Yeah, so sleep apnea, I mean, we hear this a lot, this term, but there are some trends that we're seeing right now with this, and what is it that we're seeing?
It's definitely something that's on the rise. I see a lot of patients asking more questions about it, noticing things at home that they want to discuss in the clinic. Definitely something we see increasing.
What would be some of the symptoms where somebody might think, oh, do I have sleep apnea? And then why do we think that this is on the rise?
Yeah, so one thing that I would say would maybe lead to a rise in it would definitely be kind of the increase in obesity over time. So that's a conversation we're trying to have, especially in preventative medicine. And then symptoms at home, I would say a lot of times, and most likely, it's when either family, friends, a partner notices the patient holding their breath at night. It's a little startling to them. They point it out to their physician, but other symptoms could include just daytime sleepiness when they feel like they're getting a good night's sleep or having headaches daily.
So if you start to feel like maybe, okay, people watching kind of have some of those those things, when should you seek medical attention, or when might it get to a point where it's disrupting your everyday life?
Usually I've found that the spouse is like, hey, you're going to talk about this, but truth be told, any of those symptoms are worth asking about. We'd rather know and talk with you about it and initiate that treatment if needed. Absolutely.
Okay, so let's talk about the CPAP machine, because I'll be honest, I've seen people who have to use them. Some people don't love the idea of that, or they see it and think, I don't want to use a CPAP machine. Is everybody a candidate for that? Are there other ways to treat sleep apnea before that? Walk us through what some of the treatment options are.
That's an excellent question. I'd say one of the biggest things we see is patients really not wanting to wear it, not being compliant with it. And what many don't know is that there are alternatives for treatment. It's worth doing a sleep study. A lot of times that's something you can do at home, and then talk with the sleep doctor about maybe why you can't tolerate the CPAP. But we're finding that a lot of machines used now aren't so obstructive to the face. And even for more mild cases of sleep apnea, it might be recommended to just have something in your mouth to kind of pull your tongue and your jaw forward. That's an alternative too. It doesn't have to be the CPAP all the time.
And let's say somebody wants to try everything they can first before they go to a CPAP machine or a surgery or something that's more invasive. Are there habits we can develop, or is there anything else we can do to maybe cut back on this?
Definitely. Again, kind of leading back to weight loss, diet, exercise. These are huge things that could improve your course drastically. I think some other things being maybe like sedating medications, alcohol, things that sedate you into a deeper sleep are things that definitely could be preventative, and maybe not to completely reverse the course of sleep apnea, but minimize your symptoms so that they do improve.
All right, it's good to have all this information. We know how important it is to get a good night's sleep. It can just affect everything. Katie Kirk, Advanced Practical Registered Nurse at Premier Health, thank you so much for joining us tonight.
Absolutely, thank you.